Right. So yesterday we were talking about the infratemporal fossa, and we said it was a space that was inside the skull, and that space would communicate with the infratemporal fossa by a gap that was deep to the zygomatic arc. Right. I also, excuse me. I also went further to say that the infratemporal fossa would also communicate with the midocranial fossa via the foramen ovale and foramen spinosum. Then with the orbit via inferior orbital fissure, then it will also communicate with the pterygopalatine fossa via what we call the pterygomaxillary fissure. Right. So temporal fossa is a space that we are also going to find on either side of the skull in the temporal region. So the normal thing is when you guys describe the scalp, I know we just say this whole thing is scalp, but if you look at the layers of the scalp, the third layer, which is the aponeurotic layer, it does not extend to the temporal region because in that region there is a fascia that we call temporal fascia. Right. So scalp, this temple is not really part of the scalp, but it's quite separate. And the flow for that temple is what we call the temporal fossa. And maybe not this, not this, not this. Don't mind the slides. I think I have a problem with following slides. Okay, so okay, let's not use this diagram again. Anyways, so temporal fossa is bounded superiorly by what we call the superior temporal line. So if we go back to the bony anatomy of the skull, we expect to find what we call temporal lines. And temporal lines, they are mostly found on the parietal bone, though we call them temporal lines. Right. Just give me a moment, I'll get the picture shortly. Okay. So in this region here, this is where I have the temporal fossa. Right. So higher up here, I have two lines. There's what I call superior temporal line, and there's what I call inferior temporal line. If you look closely, these temporal lines start on the frontal bone, then they extend onto the parietal bone, where the greater part of the temporal lines are. Then they end by coming to the temporal bone here. So we call them temporal because they'll end on the temporal bone, not that we find them mostly on the temporal bone. Right. So in terms of attachment, the superior temporal line serves as the attachment site for temporal fascia. Yes.
Oh, sorry.
Okay. So superior temporal line here, it serves as the attachment site for temporal fascia. The fascia that I said, when you get to the temporal region, it replaces the aponeurotic layer of the scalp, the one that we call the gallia aponeurotica. Right. Then inferior temporal line is the origin for the temporalis muscle, which is one of our muscles of mastication. Right. So if we then come back to our slide, so we have the temporal lines, and the boundaries of the temporal lines are as follows. Superiorly, like I said, there is the superior temporal line, which is the attachment site for temporal fascia. Right. Then anteriorly, it's limited by the frontal process of your zygomatic bone. Or basically, we can just say inferiorly again, there's the zygomatic bone, because behind the zygomatic arc, we said there's a space that allows for communication between temporal fossa above and infratemporal fossa below. Right. Right. So then why do you think that this statement reads this? To say that the temporal lines are the superior boundary. The correct thing there is to say that your superior boundary for the temporal fossa is the superior temporal line, right? And that superior boundary is also the posterior boundary. For this reason, these are the temporal lines here. Can you see that they also go posteriorly here? Can you see them, these ones? I'll assume that's a yes, if people are mute. Then the floor for the temporal fossa, it's made up of the bones that meet at the pterion. So I have squamous part of temporal bone, squamous part of the parietal bone, I have greater wing of the sphenoid, and I have a small part from the frontal bone. Those are the bones that make up the floor of the temporal fossa. Right. Then in terms of contents, right, there is temporal fascia, then there is the temporalis muscle. The moment you say that there is a muscle, I need to know what innervates the muscle. Whatever nerve that is going to innervate our temporalis muscle, I'm also going to find it within the temporal fossa and the blood vessels as well. Right. So does anyone want to tell me the function of the temporalis muscle from what we said yesterday? Does anyone want to tell me the functions of the temporalis muscle? I remember telling you guys that if you say la, the lateral pterygoid opens the jaw. So it depresses the mandible. Then I said all the other muscles of mastication, which is temporalis and the two pterygoids, will elevate it. But under temporalis, we are also going to say that the muscle has two sets of fibers. It has fibers that are horizontal and fibers that are vertical. The vertical fibers of the temporalis muscle are the ones that elevate the jaw. Then the posterior fibers of the temporalis that are horizontal, they retract the jaw. So they pull the mandible backward. Right? And in terms of origin and insertion, the temporalis muscle will originate from the inferior temporal line, Then the tendon of insertion, we said it goes into the infratemporal fossa. Yesterday, when we were doing infratemporal fossa, we saw the tendon of insertion of the temporalis muscle as it goes to insert onto the coronoid process of the mandible. Then, since the pterion is in the floor of the temporal fossa, we can also talk about extradural hematomas or epidural hematomas, if you want to call them. Because we say the pterion is the weakest point of the skull where the four bones meet, greater wing of the sphenoid, the anterior inferior angle of the parietal bone, squamous part of the temporal, plus the frontal bone. And that pterion is grooved by the middle-meningeal artery. To be specific, it's anterior division, because middle-meningeal will divide into anterior and posterior division. So the anterior division of the middle-meningeal artery will groove the pterion, and since it's the weakest point, the artery can be ruptured there, and you bleed outside the dura. And that will lead to what we call extradural hematomas or just epidural hematomas. If you're looking at them under radiological anatomy or imaging techniques, they look lens-shaped. So this here is our temporalis muscle. I think we can appreciate these fibers are horizontal, the posterior ones, then these ones are vertical. And I think I talked about origin and insertion. I won't bother you guys with this. Then masseter muscle. I know I didn't talk about the masseter with the infratemporal fossa. Neither is the masseter in the temporal fossa, but we need to know about the masseter. So masseter inserts onto the ramus of the mandible here on the outside. I think yesterday I gave a clear example that the medial border of the ramus of the mandible is the lateral border of the infratemporal fossa. Meaning to say, if masseter is on the outside, which is the lateral border, it's outside the infratemporal fossa. Right. Where do you think the masseter originates? Guys, anyone? Stay on the picture, guys. It originates on your zygomatic arc, eh? And I talked about the maxillary artery yesterday with the infratemporal fossa, how you divide it into three parts using your lateral pterygoid muscle, right? So these are the contents of the temporal region. Temporalis muscle and its covering fascia, which is the temporalis fascia. Fun enough, temporalis fascia is the thickest fascia in the body. Then the nerves that innervate the temporalis muscle are the deep temporal nerves. And these deep temporal nerves, I find them within the temporal fossa. Where are they coming from? Temporalis is a muscle of mastication, and muscles of mastication are innervated by V3, the mandibular division of the trigeminal nerve. Then yesterday I also told you guys that the maxillary artery, the second part, gives us branches with the same names as the branches that come from the anterior division of V3, which is buccal, masseteric, deep temporal, and pterygoid. Meaning the deep temporal arteries, they come from the second part of the maxillary artery. Then I have auriculotemporal nerve, which basically gives sensory to the skin of the temple, as well as the ear, because auriculo means auricle of the ear. This is the same auriculotemporal nerve that I said yesterday would carry parasympathetic fibers from the otic ganglion to the parotid gland. We'll see that shortly again when we do parotid. Right. Then I also have superficial temporal vessels. That's why if anyone is having a bald head, you can see your superficial temporal arteries in this region, and you can actually feel for their pulse. So it's also known as the artery for the anesthetist, especially when you're doing my head and neck surgeries, because your hands are far away where you can access easily a pulse. So you just feel for the pulse on your superficial temporal vessels. Right? They are one of the terminal branches of the external carotid. Remember I said external carotid artery will divide into maxillary artery as well as superficial temporal artery. Right? Then this is more flesh on the temporalis muscle, but I won't bother you with this. I've already talked about it, how it originates from the floor of the temporal fossa, particularly on the inferior temporal line, then goes to insert onto the coronoid process of the mandible. And the temporalis muscle has a bipennate appearance. Not knowing if you guys ever did introduction to anatomy, but muscles can either be unipennate, multipennate, bipennate. Unipennate, the fibers are running in one direction. Bipennate, they look like a leaf, and the muscles will run in two directions. Remember I said temporalis has horizontal fibers, then vertical fibers. That's where the bipennate comes from. Multipennate, they run in 3 or more directions. A classic example will be the deltoid muscle when you do your upper limb. Then I talked about the actions. In temporal fascia, we say this the thickest fascia in the body. Then there's nothing much you need to know about this. And it also gives origin to the temporalis muscle. Then if you look at morphological, not morphological, but if you look at phylogeny, well, if someone says phylogeny, what do we mean? Is someone saying something?
It's the evolution of organisms.
Evolution of organisms. So there's a statement in most embryology books which reads, phylogeny recapitulates ontogeny. So phylogeny is saying it's evolution. Then ontogeny is development. And from the simplest cell, which is a prokaryotic cell, to a eukaryotic cell, to fish, to land animals, to baboon, then to human, the development of the human being resembles that. Even if you look at development of the head and neck, we talked about pharyngeal arcs, which basically become gills in fish. Meaning fish end there, but we as human beings will progress further from that point to another point, because the way you develop, if you were taught introduction to embryology, I'm sure they will try to compare the developing embryo to a chicken, to whatever, during the early stages, because that development, or actually it should be ontogeny, recapitulates phylogeny, meaning development recapitulates evolution, right? So this temporal fascia more or less represents the shell that we have in the tortoise, which is very hard. That's why it can protect itself there. Remember, I said temporal fascia is the thickest fascia in the body. Okay. Then I know I'm about to do parotid, but we just said external carotid artery divides into superficial temporal artery and maxillary artery. There is nothing called external carotid vein, meaning the corresponding veins, which are superficial temporal vein and maxillary vein, when they join, they form something else. And what they form is a vein known as the retromandibular vein that we're going to find in the substance of the parotid gland in the next few minutes when I do parotid. Right. So any questions on temporal fossa? It's a very short region, nothing fancy about it. No questions.